My name is Marit Tanke. I'm a medical doctor and researcher from the Netherlands, and I'm working this year as a Commonwealth Fund Harkness Fellow with Partners Healthcare and Harvard School of Public Health. And I'm going to talk with you about an international collaboration that's looking at high-cost, high-need patients in 7 countries. Let me introduce you to Mr. Janssen. He is a 72-year-old man with multiple chronic conditions. In 2013, he developed colon cancer and spent a fair amount of his time in hospital. His total spending was around $300,000. So Mr. Janssen clearly is a high-cost patient. But the more interesting questions and more important questions in this case are, does the healthcare system provide optimal care for Mr. Janssen? And what part of his care might be modifiable? To understand better how our healthcare system takes care of patients like Mr. Janssen, we developed an international study looking at characteristics of high-cost patients in 7 countries. So the methodology, what did we do? We did a comparison of high-cost patients across 7 countries. We looked at the top 5% high-cost patients of all ages, looking at all medical care. And we excluded all custodial services and long-term care. And the questions we had were, how costly are these patients in different countries? What are their demographic and clinical characteristics? And what are their patterns of utilization? And I'm now going to show you the first results of 4 of these countries. Firstly, the USA. Here we use data, national representative data from the MAPS survey. It's a sample of about 70,000 people. In the Netherlands, a country with 17 million people and with an insurance-based system, we used data from one of the large healthcare insurers, about 20% of the population, about 3.3 million people. In Germany, this is the smallest sample from our study. We used the data 30,000 people from one locally operating insurer in the south of Germany. And then lastly, data from Canada. Here we used data from all inhabitants from the province of Ontario. Countries who also joined the study but are still working on the data are the UK, Japan, and Spain.